We both live in Traverse City. I've lived there since 1976. Actually met in Olivet, Michigan, a lot of years ago.
He's been my boyfriend since 7th grade.
So.
On Monday night, he got up in the middle of the night, probably was around 2 in the morning, and he said, I have a headache. And he said, I'm just gonna go take some Advil or Tylenol and sit up for a little while. And he was just out there a few minutes and he started moaning, and I got out of bed and said, well, what's the matter? And he said, oh, my head hurts. He said, I've never had my head hurt this bad. He went into the bathroom off of our bedroom, threw up, and then just staggered back and fell onto our bed and was unresponsive. So we got to the hospital and they let us go down to room 15. 15 is a room in the emergency space that they let more than 2 people go in when they think somebody's not going to make it. Thank goodness Dr. Skirmahorn was the one that was on call.
I was contacted after his arrival, after fairly significant deterioration in his level of consciousness and function. He had fairly massive amount of bleeding, and in 2 areas. He had bleeding in the frontal lobe of the brain, but also bleeding in the subdural space, which is on the outside portion of the brain between the surface of the brain and the skull. And both of those processes were causing increased pressure within the confines of his skull and shifting his brain from one side to the other.
He said, well, we're not equipped to handle what's going on here, and he's too bad to leave, but I do have an association with U of M, and he said, I'm gonna call down there and see if there's anything that they can offer.
He thought that this could be a vascular abnormality, potentially a brain aneurysm, and thus called me stating that once he was done with his part, he would like to transfer the patient here for further management and evaluations.
He was then transferred to University of Michigan, where Dr. Pandy had assembled his team to begin further evaluation and treatment.
We admitted him into the neurosurgical ICU, and then we needed to do further assessments to understand why did he have the bleed in the first place, as any repeat bleeding would be deadly. We were actually able to identify a particular type of aneurysm or vascular abnormality that we call a dural arteriovenous fistula. It's extremely uncommon, but can be deadly. In this case, since the abnormality was coming off the major artery that was going to the eye, we did not want to risk his vision. We performed the open surgery, found the abnormality, were able to excise that abnormal segment, which really didn't have any normal function. I think collaborations like this are extensively important.
The collaboration with Dr. Pandy ultimately led to a more refined, more directed treatment than would have been available even several years ago.
He's made a remarkable recovery. Merrill is back to doing the things that he was doing before this bleed took place. And in fact, when I see him in clinic visits, as well as when Dr. Skirmahorn sees him in clinic visits, we're unable to tell a difference between his prior functionality as well as now.
We thank God every day, multiple times a day, for Dr. Skirmahorn getting it started, and Dr. Pandy and everyone else that did everything that they did. It's a true miracle, really.